Okay. Thank you. Hello, and welcome to Florida Climate Week and this session on child health in a changing climate. A discussion with 4 pediatricians, Drs. Michelle Kerwin, Dr. Lisa Patel, Dr. Lisa Gwynn, and myself, Judy Schechter. We will kick off with a brief overview of the effects of climate change on child health and why children in particular are at special risk. Each of our panelists will then speak to the different aspects of climate chaos for kids. I've asked them to get real and get concrete, meaning they will share real patient examples of how our environment has harmed children in their care. Each will highlight different climate change-related threats to child health, and the group will share concrete action steps we can all take to make our lives and our planet more healthy. My name is Judy Schechter. I'm a pediatrician, former chair of pediatrics at the University of Miami and Jackson Health Systems, former president of the American Board of Pediatrics, a prior health policy fellow for the National Academy of Medicine and the Robert Wood Johnson Foundation. Like a growing number of doctors, I've come to realize that climate change is the most urgent health concern of our time, and it requires all of us to make life-saving changes. As a pediatrician, I can't help but recognize that children are disproportionately affected by environmental hazards of heat, air and water pollution, shrinking water and food supply, and vector-borne diseases. According to the World Health Organization, 88% of existing global burden of climate change-related disease falls upon our youngest and most vulnerable, specifically children 0 to 5. But even before birth, research shows that increased heat and fossil fuels are associated with prematurity, which itself can cause growth, respiratory, and brain development issues. Because these children will grow up in an altered environment, and because early exposures affect their still developing brains and other organs, for kids, the disease insult is not one and done, but continues to affect them profoundly with physical, emotional, and cognitive impacts. Why exactly are children more at high risk? Well, it has a lot to do with their stage of development, dependencies, behaviors, and exposures. When children grow, it's not just that they get bigger. Inside their bodies, the brain, the immune and nervous systems are still developing. So insult or injury affects them differently than it does to adults, and it may impair future healthy development. Their metabolism is different from adults. Babies and young children breathe faster every minute, increasing their exposure to toxins in the air. They need more calories and nutrients than adults do, so they eat more relative to their size, which increases the effect of food scarcity or contaminants in water and food. And very young children, we know, put everything in their mouths, increasing their exposure to toxins and parasites. Extreme heat provides additional examples of the high risks for children. First, consider dependency. Babies can't escape overheating without our help. They may cry out, but we may not recognize it. They can't signal specifically what's wrong. Another risk, due to very normal child development and behavioral patterns, is that kids readily play outdoors, but often they don't recognize, or if they do feel something, they ignore the limits of fatigue and thirst. And this can be true even for adolescents who engage in sports and other activities, can push themselves and their peers in practice and games. And finally, we as parents have our own behaviors and cultural norms, including swaddling babies even when it's warm, or not recognizing how diapers can reduce the body's cooling ability. Speaking of cooling ability, babies have a different body surface area ratio than adults do. The amount of skin they have relative to their mass is larger than adults, which means that when the external temperature is higher than normal internal body temperature, or 98.6, babies will more readily absorb that external temperature than adults do. And this is compounded by a few other factors, such as a high metabolic rate, So they actually make more heat for their size. And though we know they'll sweat, it may not be enough. The sweat glands or the eccrine glands are not fully functional in babies and toddlers. And finally, I want to bring up a risk that has nothing to do with their physiology or behavior. It's about us and our society. Poverty puts people at risk of climate change disease. It is a disproportional risk. Research has shown us that the poorer neighborhoods and cities are hotter. In 70% of U.S. counties, poorer neighborhoods and those with more people of color were as much as 7 degrees hotter than the wealthier census tracts in the same cities. That matters because half of our children are children of color, and 49% either live below the federal poverty line or without the resources for basic expenses needed for living, as defined by the ALICE threshold. My own wake-up call to recognize climate change as a pediatric issue came in 2016. Living in Miami, I knew that we had regular but still occasional cases of dengue in West Nile. But in 2016, Zika virus was discovered 2 miles from my hospital. Zika's most crushing effects were on our most vulnerable, babies exposed in utero while their brains were still not fully developed. We immediately stood up a multidisciplinary Zika response team for our local families. And we designed protocols for screening and following mothers and babies. We amplified the Department of Health messages about mosquito control. Still, families with pregnant women who had no choice but to live and work where the disease could be transmitted were worried their entire pregnancies, and many continue to, afraid that possible outcomes will show themselves as development goes on. In the next year, 2017, a 16-year-old collapsed during his high school football practice. His temperature was recorded at 107 degrees Fahrenheit. The heat stroke that caused his organ failure was irrecoverable. In their grief, the teen's parents recognized that his death was preventable, and they worked to make change. Their efforts resulted in the 2020 passage of the Zachary Martin Act, requiring Florida high schools to implement safety guidelines for outdoor practice, which recognize the risks of heat stress and also provide for hydration and cooling. But I don't think any of us believe it should take that kind of loss to make change. So let's bring in our experts and learn from them. On our panel today are 3 pediatricians, all respected in their communities, all of whom have cared for patients sickened by climate crisis. And even as these doctors have worked with individual patients and families, each is also working to bring system and societal change to improve our future. First up, we'll hear from Dr. Lisa Gwynn, an associate professor of pediatrics at the University of Miami, where she directs community pediatrics, leading the teams that provide free care through the Pediatric Mobile Clinic and at schools in and around North Miami and North Miami Beach. The Pediatric Mobile Clinic is often a bellwether of environmental and community change, caring for under-resourced patients, including new immigrants. Dr. Gwynn is also past president of the Florida chapter of the American Academy of Pediatrics. Following her, we have Dr. Michelle Kerwin, the Chief Medical Officer at the Center for Family and Child Enrichment and the Pediatric Family Health and Wellness Center, a federally qualified health center providing comprehensive health care, behavioral health, dental, and social services in Miami Gardens. Dr. Kerwin is a member of the Florida Clinicians for Climate Action. And finally, Dr. Lisa Patel, a pediatrician and neonatal hospitalist who is also associate professor at Stanford, practicing in Pleasanton, California, where she has dealt directly with the health impact of wildfires, particularly for the youngest of children. Dr. Patel is the executive director of the Medical Society Consortium on Climate and Health and is author of a number of educational tools on climate change and health. Their full bios are available to you on the conference website, and we're lucky to have all of them speaking to us today. So let's start in our own backyard. First with the Floridians, Dr. Gwynn and then Dr. Kerwin. Lisa, what do we need to know?
Well, thank you for the opportunity to speak today, Dr. Schechter. We need to know a lot. We need to know about the environment, the climate change, what it's doing to the environment and how it affects children, and also how it affects their health. We on the Pediatric Mobile Clinic program, we go out into neighborhoods and we see firsthand the effects of climate change, especially as it relates to the devastation that extreme weather events can cause to the physical environment of children. So we see, challenges after a hurricane, challenges to get to a physician, to get out of neighborhoods, to be able to access food. We see, as far as impacting health, we see increases in vector-borne diseases. So there's a lot of different areas that impact child health as well as their education. So I would like to share a couple of stories about cases that we have seen on the Pediatric Mobile Clinic, and maybe I can also share some stories about what we've had with our school health clinics, because schools, children spend a lot of time at schools, and we have our providers in the clinics that are co-located within the schools, and we have challenges there as well. But on our Pediatric Mobile Clinic, of course, during the time of Zika, we did see infants that were born of mothers that were infected with Zika, and we were able to connect those uninsured patients to care within our Zika clinics that we established there at the Jackson Health System during that time. And so we were very fortunate that other parts of the tropics didn't have that luxury of being able to connect some of those babies that were impacted by Zika. But we, of course, we had a couple of infants that came in, and we were able to connect them to care. We've also seen some interesting tropical diseases that we don't normally see in the United States, such as chikungunya. We've had a couple of cases that actually have new arrivals that have come in with just very vague viral type symptoms, if you will. But symptoms that have persisted for quite some time. And thankfully, we were able to provide that, world-class care to these uninsured families. And we had, in fact, 2 cases over the last several years of effects of the chikungunya infection. One child in particular ended up having a very dangerous platelet count abnormality, and which led to a bleeding disorder. And so we actually had to admit that child right away. The second case was more of just an extended period of viral syndrome, very similar to what we're seeing now with long COVID. So those are just a couple of examples of what we see out there in the community that normally we wouldn't see, based on the changes that we see in our environment. And in our schools, what we do notice when we have, hurricanes are always part of our lives in South Florida, and the loss of electricity and so forth. We see a lot of impact on children that have chronic health conditions, especially respiratory conditions. Of course, the air quality changes when the climate changes. There's an increased levels of mold and pollen and other things that can impact asthmatics. But also when we have extended amounts of time that without electricity, children that need equipment, for example, for breathing treatments, oftentimes they struggle and they're not able to have the proper treatment of their respiratory conditions because of the lack of electricity. And we've seen also in our school clinics, they serve as shelters when hurricanes are impacting our communities. And not all shelters have the power sources that are needed for the specialized equipment that oftentimes children with chronic health conditions need. So those are some examples of what we see on the front lines of working out in the community, both in our school clinics as well as our pediatric mobile clinics.
Dr. Gwynn, thank you. I'm struck by what you have to say about kids with special needs and making sure that they're prepared in normal times, because of course they need electricity when it's just hot and when it gets hotter. But as you point out, 6 months of the year in South Florida, we are in hurricane season, right? And we're usually preparing sometime before that. What do you do? What do you recommend to people to get ready for that season if you have a special health care child?
Yes,
Is there advice?
absolutely. Have those conversations with your pediatrician ahead of time so that, just knowing, okay, planning for the worst. We're not going to have power for 2 weeks. So what do we do with for example, a nebulizer? So we make sure that they have a battery operated nebulizer. We make sure that the medication supply is sufficient so that they won't run out of medication. Just any supplies that child may need. And also having an emergency plan, knowing how to get in touch with somebody, because doctors' offices are typically closed during times of emergency. So making sure that the parent has the proper contact information that they could reach out to, or at least an emergency plan on what to do, even especially if calling 911 may not necessarily help in the acute phase, like what they can do for their child immediately. So those are the things that I would recommend.
Thanks. And just in case any of our listeners don't know this, right, that there are special shelters that should have that electrical connection for them, for kids that really need that, for any family member that needs that. It's a matter of letting your needs be known with the Department of Health, and you can work with your pediatric provider to make that happen. And as Dr. Gwen points out, get an advanced supply of medicine, because as the hurricane approaches, and even before that, you can get an extra month of medication and stock up. Thank you so much. Can I ask you one more thing about, have you seen the king tides that we used to see twice a year are much more prevalent now? I always get afraid about flooding after a hurricane or king tides, that kids are going to get injured, or the broken glass or electrical power line or something. Have you seen that? Is that something that you feel you bring into anticipatory guidance?
Absolutely, especially if families live near the ocean, near water. It's definitely an issue that creeps up on us, and it's not always well known that this is happening. So we do try to counsel our families for children that have chronic respiratory problems, that algae blooms is something that can impact their respiratory status. So certainly we try to do that anticipatory guidance ahead of time. And also children that are very active and swim in lakes and so forth, there's a lot of infectious diseases that are found in lakes. And so again, having those discussions ahead of time, understanding what the patients, the children like to do, and those kids that are outdoors a lot or that have chronic health conditions, to make sure to be prepared ahead of time.
Dr. Gwen, thank you for sharing all that and for reaching kids where they need that care, where they are in schools and wherever the bus goes. So thank you for that work.
My pleasure. Thank you.
Dr. Kerwin, you and your patients are encountering some of these risks and others. What can you share with us?
So just to echo the sentiments previously mentioned, that children have unique vulnerabilities when it comes to climate change, and these things can have lifelong consequences on physical development, on cognition, chronic diseases, other complications, and especially, their physiology, their bodies are changing, and especially in the earliest stages of life, they can be most vulnerable. I'm going to highlight two cases from my practice and also talk a little bit about mental health in children due to changes in that due to climate change. So the first thing I'd like to highlight is just the rising sea levels and how that affects our sewage system, our waste system. So when we have increased temperatures of climate change, we have glaciers that are melting, which creates more water. We have increased precipitation. We have more intense rain and snowstorms, and all of this creates more water and higher sea levels along our coastlines. And those changes in sea levels increase what is called our ground table. In the ground table, you might hear ground table or water table. The ground table is the top of the soil is unsaturated soil, so there's no water. And then we have a water table, that's the top of the demarcation between unsaturated and saturated soil. And then below that, we have the ground table. And that ground table, that saturated ground, that level is rising. And as that rises, it can affect our sewer system. And as Dr. Gwynn mentioned, we're seeing more infectious diseases in lakes and rivers and so on. And this is part of the reason. So for people who have city sewer, your sewage, your waste from your homes and businesses goes into the sewer pipes. It also drains with water down from down pipes or down drains from your homes and street water and from your driveways and so on. All that water combines, goes to a plant that disinfects it, and then that disinfected water goes back into our lakes, rivers, etc. If we have they have overflow pipes, but those overflow pipes bypass the plant that decontaminates water, so that contaminated water then can get to our rivers and lakes if we have overflow or increased volume of water linking into those systems. So with more rain, more flooding, all of that, we're going to have those overflow pipes can also be, eroded more, and we are going to bypass those plants that decontaminate and get this contamination in our water. The other way is for people who have septic tanks or small businesses that have septic tanks rely on the septic tanks work because of that unsaturated ground that it sits in. When the sewage waste comes into the septic tank, it gets cleaned by naturally occurring bacteria and chemicals within the tank, within the ground. The sewage, the waste from the septic tank, the water waste goes through to the drain field. The drain field also has those microbes and chemicals that clean it. And then the rest of that water waste goes through the unsaturated ground to the saturated ground, the ground table, and gets reabsorbed. Now, if the septic tank system relies on that ground table being at a certain constant level. So as that rises, we get backup of these systems, and it can back up to the drain field, the septic tank, and into the homes. So I'll tell you briefly about a family of mine who this happened to them. They had a septic tank in a small apartment building they were living in, and everything backed up into their home. And they were the entire family, and there were about 7 people living in the home. They were extremely ill. They were having bad diarrhea, vomiting. Their stools were like a whitish gray color. There had to be some toxins even in the air because they were passing out. They would be sitting around talking, and next thing they would wake up hours later, and not even knowing what happened, not even remembering, falling asleep, so to speak. And they actually had a black widow spider problem as well, and ended up having a hospitalization of one of the members of the family, and one of the members of the family almost lost their leg from the spider bite. So it just highlights how important our sewage system is, and how important what the effect of sea level rise can have on our waste system. And the bacteria, fungus, parasites that get into our waters that are supposed to be clean, and viruses as well, can cause things like diarrhea, cramping, vomiting, headache, hepatitis A, which causes liver disease. So we really have to be mindful of this. And I won't go into what needs to happen with sewer systems, but states and municipalities would need to get involved with that. The second example or thing I'd like to talk about is air pollution. And I know Dr. Gwynn touched on it, but as climate changes, we have more outdoor air pollutants like dust from droughts and wildfire smoke and ground level ozone, particulate matter, increased pollen, prolonged allergy season. And all of these things increase asthma and allergies and other respiratory conditions. And Dr. Schechter, you mentioned that kids breathe faster than adults, and they also spend more time outdoors than adults. So they have increased exposure to these pollutants. And when we have heat waves, the higher outdoor temperatures drive kids to stay indoors. And then there's more exposure to indoor pollutants like tobacco smoke and mold. Floods and extreme weather cause standing water intrusion into homes, like leaks from the roof or windows or pipes, and that encourages mold growth, which also exacerbates asthma and allergies and other respiratory conditions. And poor air quality doesn't just affect our respiratory health. It can also lead to cognition and learning disorders, cancers. In utero exposure can lead to preterm birth, low birth weight, and birth defects, especially from wildfire smoke. And we also see increased ER visits and hospitalizations, which lead to increased school days missed and missed work for parents. So one of my patients, well, the family, there were two siblings, two babies, and they had, a lot of wheezing, eventually diagnosed with asthma, really bad eczema, really, really bad eczema. And they were constantly in the office every month at least. And they were very young, 6 months, 7 months, 8 months. Every month they were in the office. Every month I'm treating them with albuterol and treating their eczema and so on. And I'm asking them, questions, is there any smokers? Is this, is that? And eventually I figured out that they had mold exposure. And it was just incredible. The degree of eczema was horrible. The wheezing was constant. And, I have given up telling people to fight the landlord about mold. I just now say, move out, just pack up your stuff and leave. But they weren't able to do that right away. And one day they just stopped coming to the office. They showed up maybe, 6 months, 8, 9 months later for a regular well check. And I was like, where have you been? And they had actually moved, and they had no asthma, no eczema, no nothing, no symptoms of anything once they moved out of that apartment. So it just really highlights how vulnerable we are to the air pollutants. And the last thing I want to touch on briefly is just mental health. Children are developing emotionally, their brains continue to grow throughout adolescence, and they're very susceptible to the mental health impacts of storms and fires and other extreme events. They suffer from other changes like having to move because of climate threats, or their home damage or home loss through flooding and fires. The stress and anxiety for their parents, if their parents have their livelihoods affected, like farmers are affected by temperatures and droughts and flooding, that can lead to financial challenges that then are troublesome for the children too. That anxiety in the parent is seen by children. Food production and distribution can be affected by wildfires, heat waves, floods, droughts. We see increased costs and limited availability. And when children don't have access to healthy food, it doesn't just affect their nutrition, it affects their mental health as they become food insecure. Rising temperatures increase violent incidents and suicides, and kids may be exposed to these things with their family members. Anxiety in general, just from knowing that climate change is a thing, and what does my future look like? If you're a child and you know about climate change, and you're worried for your future. And while kids can be very resilient, these mental health impacts can last into adulthood if they're left untreated. So it's really important that they have support systems, because these types of mental health issues, these climate change disasters, natural disasters, extreme weather events can cause anxiety, depression, trouble sleeping, phobias, post-traumatic stress. So, bottom line is you need to speak to your pediatrician and make sure you are consulting a mental health professional for your child. So I will wrap up there.
Dr. Kerwin, I'm so glad you brought all of those examples to us, and particularly that you emphasize this about mental health, which is just incredibly important. We had a crisis of pediatric mental health before the pandemic that got much worse during the pandemic. And this to me is underscores the reason why educational panels like this are so important. That we all have to act. We as adults can't throw up our hands and say, oh, great, looking forward to the future, because our kids need that. Your patient examples, you can let us know, but I'm wondering if there must have been mental health issues there. The frustration of living in a home with sewage, and you shared with me a former time that it was just impossible for them to move, right? So yes. That hopelessness or helplessness, what that translates to for everyone in the family, including the kids.
Yeah. And they didn't have the money. They didn't have the means to leave that house that was sewer ridden. Eventually the city came in and declared it, uninhabitable. But there was a good period of time where they were there. They were trying to fight the landlord. They were trying to get their deposit back to be able to move out and get something else. And they just couldn't. And the family had to stay there, and they kept coming to me with continued vomiting, continued diarrhea, and there's only so much I can do. You have to be removed from this situation. I mean, at that point, I'm like, do I need to dip into my bank account and get them into an apartment, that they can be safe in? It was so sad to watch. And, we really tried to bring in social services and help them get situated, but it takes a while. It's not instantaneous. And when you have sewage backing up into your home, you have to do something about that immediately.
Thank you. And I want to underscore what you just said. You were somewhere between there's nothing to do and pulling out your wallet. You were writing to social services, and I imagine writing letters on their behalf, which is not, all that we're trained for, but it's so important in these situations. And hopefully will be part and parcel of the policy changes we need to protect these families.
Yes, just a plug to vote. And make sure you vote, you go out and vote because things like these can be affected by voting.
Thank you for that. So Dr. Patel, I am so pleased to have you with us. I recognize that we've kind of focused on Florida so far, but as we learn more and more about the areas that are affected by climate change, it's all over the map, right? There is no, I recently saw a map of the hospitals that have had to respond for flooding or fires or smoke or heat, and it's everywhere across our nation. So we'd love to hear about how this is playing out in your area, and as a national leader, what you have to share with us.
I think the best way to describe climate change, Dr. Katherine Hayhoe calls it global weirding. It's why you can have a polar vortex in Texas, or you can have heat waves up in Canada. You can have a hurricane in California, right? You can have wildfire smoke in New York. What we can expect now is the unexpected. And I think what we take for granted is that we've really built our human civilization in this Goldilocks zone in terms of a temperature and levels of the sea level, for example, and precipitation patterns. And we're just basically living out a very big natural experiment. And so we just need to be prepared now, expect the unexpected at this point. The way it's playing out for us in California, I grew up in Houston, Texas. So I would go from my air-conditioned home to my air-conditioned car to my air-conditioned school. And so we, even when it was brutally hot or humid outside, we wouldn't necessarily feel it because we just wouldn't go outdoors. And we had air conditioning to protect ourselves. Places like California, Oregon, Washington, these are states where we've been adapted for a very different climate. And so our rates of air conditioning are much lower than other parts of the country that are more adapted to the heat. But the other problem is that our population isn't adapted even for these small fluctuations in temperature. So an athlete in Northern California, for example, just has a different threshold of what they can handle in terms of heat and humidity compared to an athlete that might be in Miami or in Atlanta, where your body can physiologically adapt over time to higher temperatures, but it needs time. And the older you get, the harder that adaptation becomes. So what that means is when we have a really hot day I practice in Pleasanton. I was working 2 24-hour shifts over last Labor Day weekend when our temperatures topped 116 degrees. Because I do work in climate change and I know the data that there's actually a higher risk of mortality for newborns that are born during a heat wave. I was counseling my families. We care for newborns in the hospital that are public insurance patients. And so I do a lot of social determinant screening and work with my families. And I knew to ask, do you have access to air conditioning? 2 of my families did not. The traditional answer, if you're worried that a family can't have access to cooling, is you would refer them to a cooling center. But this is a family with a newborn. I mean, who's going to have a 2-day-old sitting in a cooling center, right? And so we got social work involved. We helped them find a family member that did have air conditioning that they could stay with. But we're going to have to really be thinking carefully about how all these various vulnerabilities map together and make sure that clinicians and social workers are equipped to understand what factors are protective or what factors could potentially put people into harm's way. With heat as well, the other thing we here in California have been very hit by is outdoor workers in terms of heat. In Oregon, actually, during their heat dome in 2021, a farm worker collapsed and died outside. I mean, we've just heard some horrific stories over this past summer when it's been very hot in different areas. So there's legislation that's being considered to basically ask OSHA to set better standards around when people should be outside to work. So I cared for a 16-year-old who came here unaccompanied from Mexico, took a job hauling brick in 108-degree weather, and came in with your muscles just start to break down in that amount of heat, and then it can gum up your kidneys. And so fortunately, he was 16, we admitted him, hydrated him aggressively, and we were able to reverse that damage. But we also know that people who suffer that kind of kidney damage over and over again, it can cause chronic kidney damage down the line. So that's the heat piece for us. And then obviously the other big one for us is wildfires. And I think Dr. Kerwin mentioned wildfire smoke. We estimate to be about 10 times as toxic as the regular air pollution we're always breathing because we burn fossil fuels. And this is another bit that I just want to mention, because I don't think we've said the words fossil fuel out loud yet. But we have climate change because we burn fossil fuels. And when we burn those fossil fuels, it does two things. It warms our planet, and which results in all these things, right? Like wildfire, drought, sea level rise. But it also releases pollution. And we have very good data that shows that chronic exposure to that fossil fuel pollution that we are breathing because of our gas-powered cars, our natural gas, actually fossil gas plants, are causing pollutants that we breathe in. I just wanted to make sure my internet connection said it was unstable. You can still hear me?
Yeah,
okay.
We can hear you. Yes.
So when we burn these fossil fuels, it creates these little tiny particles, so it's called particulate matter 2.5. And that particulate matter pollution, we breathe it in, enters our lungs, enters our vasculature, and basically sets off inflammation. And so we have good evidence to show that chronic exposure to fossil fuel pollution results in premature mortality, cardiovascular effects, certain types of cancer, asthma, for example. And then the data from wildfire smoke is even more concerning, because now we're not just talking about fossil fuels, we're talking about an entire house going up in flames, and those things that get aerosolized and we're breathing in that are much more noxious and much more toxic to us. This, what I particularly worry about, my son is 5 years old, and 4 out of 5 years of his life now, from 0 to 5, is when your lungs are developing very rapidly. And so this period of time where he's been, we do the best we can, but their air is air, and you can't keep it out. Even in a home that's relatively well sealed, some of it is going to come in. And so I worry as a parent, I worry as a pediatrician that we are, again, living out another natural experiment with children in places like California that are breathing this in. And the data we have from firefighters where we've studied this longer term, again, it's not reassuring. Cardiovascular disease, diabetes, certain types of cancer down the road. And now we're exposing it to very young children. At the least, I have the knowledge. We have air purifiers in our home, and I really worry, again, as we think about what we need to do to prepare our populations. We started having air purifier prescription programs, for example, so that we can ensure that families that have someone in the house, whether it's a pregnant individual or a young child or a child that already has asthma, we can find ways to get them opportunities to clean that indoor air. And we do a lot of education. I do a lot of education around DIY filters that you can do for $20, because a lot of my families struggle to put food on the table. And so if you ask them, no family should have to choose between clean air and food, but these are the choices that our families are left with. So wildfire smoke, in terms of the work that we're doing in California, we are doing a lot of work with our schools, for example, to think about how we protect kids, both in the homes and in the schools, to better protect them. But we got to work fast, because wildfires are, for us now, are no longer longer, we used to have a wildfire season, but now it's more or less yearly and more or less year round. The last thing I'll just say about wildfire smoke that most people don't think about, and I do think Dr. Curran, you mentioned it, is wildfire smoke and birth outcomes. And so I work in a level 2 NICU, and so I'll often go counsel individuals that come in who are in labor, premature labor, to tell them what to expect. And premature birth, right? There are so many different factors that go into premature labor, premature birth. But there have been times, especially when we've had weeks and weeks of smoke, my NICU fills up. And so I do get that question, is it my fault? Is it something that I did? And I've started to build in wildfire counseling into talking to people that ask, like, why did I go into premature labor? Because I think it's important that it is not your fault. Absolutely not. This is a big risk factor for it. And I try to use it, to Dr. Curran's point, as an opportunity to change, to say, this is why voting matters, because we need policies in place to make different decisions, basically, than the ones we've made in the past.
Wow. Thank you, Dr. Patel. I appreciate that. And I think all of these stories underscore how important it is for us to think about our planet, our kids, our people. Like the disparity potential here, which is real, it's happening, is so large. I remember well-to-do patients of ours who moved out to California when the wildfires were hitting and had young children, and called and said, should I come back to Miami for a while? And that may have been the best decision for him to make with his family, but it's not a decision that everyone can make when they can't afford even the purifier versus food, right? So this is something that we got to find the solutions that work for everybody, for sure. Yeah. Thank you for that. I want to welcome Dr. Gwen back. If anybody who noticed that she was gone, she had a storm hit her and the power went out.
Extreme weather event.
Not a health issue, just a tech one. Glad to have you.
Thank you.
Maybe we can talk about a few other issues that I hope will also get us to think about what's coming in the future and what can we do now and into the future that's concrete. So let me ask a little bit, Dr. Patel in particular, you brought this up, but you may all have opinions about, the summer. We just finished summer. It was the hottest ever, right? Our July was the increase for July, not just that it was the hottest July forever, but the increase was half a degree rather than the incremental 0.1 that we used to get. This is not expected to turn around in the short term, right? Summer's going to look like this, hotter and hotter. What happens for us in terms of summer camps and outdoor activities for kids and family vacations, all great things that are fun, but also part of our child development? What does that look like in 10 years?
Would you like me to start?
Sure.
Yeah. So I think people have probably seen the statement that this is going to be the coolest summer of our life, and that's true for every year moving forward, and that should sober us because of how hot this summer was. So in terms of, and we already saw from this last summer, there were camps that had to be called off, or school days that had to be shortened. I think what we're going to see is just a big shift in our activities, where the summertime really isn't our time to be outdoors. It's going to be safer to be outdoors, maybe in the spring or the summer, depending on what region of the world or what region of the United States you're living in. And we'll just shift our activities to sort of staying outdoors more into the fall and the early winter and less over the summer. So I don't know what that will look like or mean for areas where camps traditionally were outdoors more, and perhaps you just shift. If you have the means to send your child to a summer camp, you instead send them to a winter camp if they want to spend some time outdoors, as opposed to just being trapped inside a cabin that might have air conditioning, for example, for a couple weeks at a time. That's what I sort of see happening over time.
I think also just in not just summer camps, but I think we're going to have issues with sports, football, soccer, track and field, all of the outdoor sports. What are those going to look like? Kids are going to need to really hydrate well. practices might need to be indoors more often than outdoors, and saving games for outdoors. Games might more so need to be at nighttime versus daytime games. I mean, I don't know that we know what it's going to look like, but even aside from heat, and, we touched on air pollutants and, making sure that the air quality index, you can check the air quality index forecast in your area. And that might be something we regularly learn to do before children, are outside. Also high traffic areas with pollutants. So I think a lot of outdoor activity is going to change. And then, as I mentioned, indoor activity still has exposure to indoor pollutants as well. So it's very difficult between heat and air quality. It will be very difficult for children to be outdoors. And then we also need to watch what's happening indoors.
I'd also like to add on to what Dr. Patel said regarding education. And I think that in the future, we're going to have to do a more comprehensive job at educating children on climate change, not just the causes of climate change, but the health effects of climate change. I mean, I never, when my daughter was growing up, I don't think that I ever really had a discussion about the environment and how it could impact her health directly, So I think those are conversations. Not only do we have to have that with the parents, but we also have to do the same with children so that they can be armed with that information to protect themselves against dehydration and all of the other harmful effects of the environment. And I also want to say, in our school health clinics, our nurses treat kids, athletes all the time, every season, especially in early August when the football players are training before the games start. They come back typically during the summer months, and they're typically not really exercising between June and July. They kind of take the time off, and then when they hit the practice field and the weather is still super hot, we do see a lot of athletes going down. So again, having that education between parents, the students, the school nurses, and the coaches, all around how to keep kids safe. And our, especially with football and sports, it's so hard to change that seasonality, because it impacts, for example, our athletes, scouts come into town, and they're, the game times and the play time is so important. So the thought of canceling a game because of the weather, I mean, that's kind of unheard of. So, I really feel for kids, especially those kids that are out in the field, out in the heat, and that are up against all of these challenges. So, interesting times to see how things evolve.
Dr. Gwynn, I want to piggyback on what you had to say about the importance. So we have, three very informed people here who are able to teach their parents and children about this. And I wonder a couple things, because Dr. Kerwin referenced the heat index, but are any of you teaching families the difference between the outside temperature and the heat index and how humidity affects that? Is that important for them? And two, while you've learned up, probably on your own somehow. I didn't go to a medical school that taught this. Where I taught didn't teach this. Is this something that should be standard across the health professions, not just for doctors, but for nurses and others?
I mean, certainly we should add it to our list of anticipatory guidance and, all of the things that we have to talk to parents about. I mean, certainly. Yeah, I mean, it is a reality. And I think it's something that those conversations that we really have to have, and not just in our offices, but also in the classroom and everywhere else that we can have the opportunity to inform the public on what's to come. So definitely.
I think it definitely needs to be a part of medical school curriculum, because it's here and it's worsening, and it's a part of our future. And future physicians need to know how to teach. And as things change, as guidelines change, just for things like sports and camps and so on, they're going to need to know, what advice to give to families.
Perhaps it could be social history, medical history, climate exposure. That could be part of our, our structure of our templates of how we ask those questions to families and patients.
Dr. Patel was part of a group that helped design, describe some potential models. Dr. Patel, if you want to put your Lancet in the chat or something, the Lancet article, so people can
sure.
find it.
I'll look it up in a second, but I want to talk a little bit about a solutions frame because, for example, medical students have recognized this need, and rather than wait to convince our generation and above, they started creating that content themselves. And so it started as a volunteer effort. They created something called a planetary health report card to compare institutions. Thanks to their efforts, there is now, it's called the Climate Resources Education Hub, I believe, where you can actually download peer-reviewed PowerPoint slides that you can just drop in to your lectures. And so, and many medical schools are now, our medical school at Stanford is now integrating climate change across the curriculum, as are many other medical institutions. So we're getting there. And so I think this is a call really for all of us to really engage the youth that are interested in this topic and help mentor them. And what's been really great to see is that faculty who didn't know anything about it, they agreed to help the students, and they both learned, right? Because the faculty were able to bring their expertise. They read and learned together with the students to craft these materials. So you are never too old to learn. There's always an opportunity. We have to be willing to try. And then I would say, absolutely, yes, it should be a part of our longitudinal education in terms of the materials that we develop.
Students, we love learning from you. So I've heard climate weirdness. We've talked about extreme crisis, danger. We see graphs about things worsening. But we really want to foster hope. We as pediatricians are focused on the future. So how do each of you keep your cool?
No pun intended.
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 Guilty.
I mean, for me, I have a practice that has sort of evolved over the years. That more how I maintain my sanity with, I don't have children, so I guess I have less of an extreme fear about climate change. I do worry about climate change for my relatives and my friends who have children, but I don't have children of my own. But still, obviously I'm a part of the Florida Clinicians group. And so it is something that's important to me. So I keep my cool, I keep my sanity. Every morning when I wake up, I say thank you, and I list what I'm thankful for. Before I go to bed at night, I write in a grateful journal, this is what I'm thankful for. I've recently picked up meditation. I'm not good at it yet, but I am trying. I'm trying really hard to stay focused. And I exercise. I do Pilates weekly, and I just got the class pass. And so I've been doing various classes, yoga classes, even yoga combined with meditation classes. And so and then I try to be social. I work a lot, but I try to maintain a social life and that social balance. And then family is of utmost importance to me. I got married last year, so I try to spend quality time with my husband, and my parents and my brothers are up in Tampa, and I try to get up there as often as possible. And those are the things that sort of ground me and keep me sane. And then just being a part of the solution, educating myself, like we talked about, on climate change, and continue to talk about it and spread the word as much as possible. To me, as a pediatrician, my patients are my kids. And so, I have that concern for them, for their future. So educating parents and children is very important for me. I'm actually an educator at heart, I think even more so than being a pediatrician.
What a wonderful list of self-care techniques. Thank you. Lisa's? Anybody?
Well, I wish I had that self-care list, but I can't say that, but I'm working on it. I have a treadmill in the background. It's calling my name. With anything in health policy, especially child health policy, it's really one step at a time. You can't, you have to meet people where they are. If you have opportunities to speak to legislators or decision makers, you have to frame the conversation about what they'll be receptive to. Just having patience and knowing that small steps are better than no steps. So that's kind of how I keep my cool whenever I have those crucial or critical conversations, and knowing that it's a marathon, not a sprint. So that's kind of what keeps me going.
Thank you. Dr. Patel?
I think I've built my career on not being cool. Get hot. I get very passionate about things. But I think how I keep my hope is really just the community of people that I've built up that I work with on climate change. I'm on text with a few people in particular where if I just need to vent, as a leader in the climate movement, it's important to me to, even though the data is distressing, I really try to emphasize that the solutions are actually much more exciting, right? We're talking about creating greener cities, clean air, parks where people can connect with one another, places where you can bike, walk, or use public transit to, the opportunity to get to know your neighbors, see them more, other people within your community. I mean, all the solutions that we're talking about for climate change are good ones that are good globally for our health. And so I really try to center in the vision of what it is we're trying to achieve, and that's just such a good thing to be thinking about. And then I try not to read. I try to take media breaks. For me, the summer is the time because we have those wildfires hit every summer when my anxiety really starts to kick in. So I try really hard to just not consume too much of it because I know what's happening. Yeah, I don't need to open the paper to know, and just try to really focus on the positive.
That's really important. We do that with families. I think every hurricane that's coming, like, stop, you can check the NOAA twice a day, like that's enough. I do have children, Michelle, as you know, and they remind me every day, sometimes twice a day, that I'm not cool at all, and which is fine. But like you, committing to the solutions helps keep me sane. And there's an ancient text, so that we don't have to think we have to do it all. It's not your job to complete the task of healing the world, yet you may not desist from it either. And so in South Florida, we'll say, poco a poco, let's do our part. Let's end this with a little bit of advice to families. What, if there's anything that we didn't cover, something concrete that you want families to know they can do today, this week?
Wow, that's a tough one. I would say just being mindful of the environment and also how it impacts your health, whether it's your physical health, whether it's your emotional health, and the environment is still beautiful. So get outside when the weather is nice and enjoy the beautiful outdoors, because that is the key to having good mental health, to be out there in the environment.
I'd say make sure you're registered to vote. Make sure that your circle is registered to vote. Because for so many reasons, I mean, the reason why climate change is our greatest health threat in the 21st century is because it takes all these other threats, poverty, housing insecurity, food insecurity, and makes them worse. So whatever issue, you as a pediatrician or you as a caretaker are passionate about, I promise you climate change touches it in some way. And the upstream way to solve all of these is to have decision makers in place who understand what these problems are and are willing to address them. So vote, and make sure your circle is registered to vote as well.
Dr. Patel, you took my answer that I was going to say, but I just want to add a little something to that, because there are populations that don't tend to go and vote because they don't feel like their vote matters, that their voice matters. They don't feel like they feel they're down here and politics is way up there, and it's selfish and it's greedy and it's money and so on. But these things are touching the most vulnerable communities. Climate change is the biggest impact are on the most vulnerable communities, most disenfranchised communities, and typically many in these communities don't vote. So I just wanted to say this is a very good reason to think, hey, my voice does matter and this does impact me. This actual vote does impact my health. So that's one. And then I would just say really take care of your mental health. Everything is kind of top down. And then join an organization or volunteer, educate your children, educate yourself. Don't wait for your pediatrician to educate you. Educate yourself on the daily small things that you can do to help improve our environment. I had my car, I lease a car and it's up for renewal, and I actually extended my lease because I just didn't have time to deal with it. And now I'm really like, you know what? I need to get an electric car. I really need to consider getting an electric car. So that's a bigger thing, but there are a lot of daily small things that we can do to protect our planet. So educate yourself, talk to your physician, take care of your mental health, and be a part of the solution.
Thank you all so much. I'm going to add a little bit to your list. I'm going to reach even further. I want them to vote, but I want people to check out what's happening in your local communities. The internet has all the agendas of what your lawmakers are voting on. Let them hear from you. You can write, you can show up, you can call. Let them know if they're not doing anything on styrofoam or plastic or shade cover or electric buses to take your kids to school. Tell them to do this. There's so much room here for us to change policy. And you're right, everyone's voice matters. We just don't always lift it enough. And those intentional choices that Dr. Kerwin's talking about, like getting involved and cleaning up the beach and changing your own personal use around plastic and where your water, hopefully if your water's safe, you can use the tap, and most of us are in those communities. New versus used clothing and other choices, sharing economy and supporting that with your neighbors. And then I want to emphasize something for our special population of adolescents. We've talked about them in terms of the climate anxiety and the mental health issues that they're facing. Support them in your families. When they say something that seems outrageous about this, or they're very emotional about this, don't tell them they're too emotional. Give them that love, hear them out. This is a real serious thing. If they want to go vegan or vegetarian, you can take them to their doctor and talk about how they do that healthfully, but support that and let them know that you're agreeing with them and Dr. Kerwin, you're going to do an electric car as well. So it's not just our planet, it's their planet for the future. So take care of them and take care of yourself. Thank you to our amazing panelists, Dr. Kerwin, Dr. Patel, Dr. Gwen. I so appreciate your time, and I look forward to more good news in a subsequent visit. Thank you.
Thank you.
Thank you.
Thank you.